Checklists. That's how institutions pretend they care about safety. Make a list, print it out, hang it on the wall. Now everyone's covered, because if something goes wrong, you can point to the checklist and say we had protocols, we had procedures, we followed the system. Except nobody actually uses the checklist. Nobody enforces it. Nobody verifies it. It's just paper on a wall. Documentation theater. 7 people saw problems. 7 people had responsibilities. 7 people assumed someone else would act. And 12 elderly residents died over 3 months. I'm Spike. Fork. Item number 4. You've heard 3 confessions. Michael and Sarah's wedding. Anaphylaxis. La Bella Vita restaurant. 8 deaths. Batch 2019 AC recall notice buried in spam folder. All from bacteria hiding in my cracked 3rd tine. All preventable with testing. That was Season 3, patterns ignored. But this is Season 4, Episode 3. The system that watched. Subscribe to Spoony and Friends, because this episode is about a nursing home where 7 people saw contaminated utensils. 7 people could have stopped an outbreak. 7 people chose not to. Write in the comments how many workplace checklists you've seen on walls that nobody actually uses. Because Sunrise Senior Living had checklists, beautiful checklists, laminated checklists, and 12 people died while those checklists hung on the wall. I'm a stainless steel fork, 4 tines, 8 inches long. Restaurant grade. Manufactured 2018. Part of bulk order. 500 pieces flatware. Ordered by Sunrise Senior Living. Assisted living nursing home. 120 beds. Located Springfield, Massachusetts. Mix of independent living, assisted living, and memory care. Elderly residents. Average age 78. Some mobile independent. Some needed assistance. Some had dementia, Alzheimer's, advanced care needs. Sunrise was mid-tier facility. Not luxury, not state minimum, middle. Adequate staffing. Adequate food. Adequate care. Family members chose it because affordable. Close to Springfield, seemed clean. Seemed caring. Licensed by Massachusetts Department of Public Health. Inspected annually. No major violations recent years. Seemed fine. I arrived Sunrise July 2018. Went into dietary department, kitchen and dining services. Used for resident meals, breakfast, lunch, dinner. I was fork number 287 of 500, assigned to main dining room. Used by residents who could feed themselves. Washed in commercial dishwasher after each meal. High heat sanitizing cycle. Standard procedure. I worked fine, no issues. Good fork, did my job. But here's what was happening. I had manufacturing defect, not visible. My 3rd tine far right had microscopic crack. Formed during production. Temperature stress. Metal fatigue. Crack was 0.03 millimeters wide. 30 microns. Couldn't see without magnification. Couldn't feel. But was there, creating crevice where bacteria could hide. Survive washing, cross-contaminate. Same defect that caused Michael's anaphylaxis at wedding. Same defect that killed 8 at La Bella Vita. Same batch. 2019 AC. But this was 2018. Before those incidents. Before recall. I was just fork with invisible crack. Working every day. Slowly accumulating bacteria in that hidden crevice. Now let me tell you about first person who knew. Sarah Mitchell, age 32. Dietary aide, Sunrise Senior Living. She'd worked there 4 years. High school diploma, no culinary training, but responsible for serving meals. Setting tables, helping residents who needed assistance eating. Clearing dishes, loading dishwasher. Basic food service. She was good with residents, patient, kind. They liked her. She cared about them. Knew their names, knew their preferences. Mrs. Anderson likes her coffee light. Mr. Patel doesn't eat pork. Mrs. Chen needs her food cut small. Sarah paid attention, tried to make mealtimes pleasant for residents. February 2021. Sarah was clearing breakfast dishes, collecting forks, knives, spoons from tables. She picked up stack of forks, noticed something. One fork felt rough. She looked closer, saw crack. Third tine, visible crack. Not me. Different fork, but same batch. Manufacturing defect. She held fork up to light. Crack went deep. Looked like tine might break off. That's not safe. Could cut someone's mouth. Could be choking hazard if tine breaks. Sarah took fork to kitchen, showed her supervisor Maria Santos, age 46, dietary supervisor. Sarah said, "Look at this fork. Cracked tine. Seems dangerous." Maria took fork, examined it. "Yeah, that's not good. Should throw it out." Maria tossed fork in trash. Problem solved. "Thanks for catching that, Sarah." Sarah said, "Should we check other forks? Make sure none others have cracks." Maria thought about it. "We have 500 forks. Check them all. That's a lot of work, and we're short-staffed today. 2 dietary aides called out sick. We're barely keeping up with meal service. Checking 500 forks would take hours." Maria said, "If you see any others with cracks, throw them out. But we don't have time to do full inspection today. Maybe later, when we're fully staffed." Sarah said okay. Went back to work. Sarah didn't push. Maria was her supervisor. If Maria said not now, then not now. Sarah returned to clearing dishes, serving lunch, helping residents. She kept eye out for cracked forks. Saw another one week later. Threw it out. Told Maria. Maria said thanks. Tossed it. But still no systematic inspection. Too busy. Short-staffed. Always some reason. Sarah saw maybe 4 or 5 cracked forks over next month. Each time showed Maria. Each time Maria tossed it. Each time Maria said we should really check all of them. But never did. Now second person who knew. Maria Santos, dietary supervisor. She'd worked Sunrise 8 years. Started as dietary aide. Promoted supervisor 3 years ago. She managed kitchen staff, meal planning, food ordering. Oversaw dietary aides. Reported to director of nursing. Maria was competent, organized, but also overwhelmed. Sunrise was chronically short-staffed. Dietary department's supposed to have 12 staff. They had 8, always running behind. Always playing catch-up. Maria worked extra hours. Came in early. Stayed late. Tried to keep department functioning despite insufficient staff. When Sarah started reporting cracked forks, February 2021, Maria knew this was problem. 1 cracked fork accident. 5 cracked forks pattern. Pattern meant potentially all forks from that batch defective. Should inspect all. Should replace defective ones. But Maria also knew inspection would take time. Staff time. Resident meal times couldn't stop. Kitchen couldn't shut down. Would need to do inspection during off hours. Early morning, late evening. Would need to pay staff overtime. Or ask them volunteer extra hours. Staff already exhausted. Asking them stay late, check forks. That's hard sell. Maria decided to handle it different way. Document it. Report to her supervisor. Let administration decide how to proceed. March 2021, Maria wrote memo. To Director of Nursing Deborah Price. Subject, dietary equipment concerns. Memo explained situation. Dietary aides have found several forks with visible cracks in tines. Approximately 5 forks identified over past month. Cracks appear to be manufacturing defects. Recommend systematic inspection of all flatware to identify and remove any additional defective items. Estimate inspection would require 4 to 6 staff hours. Request guidance on scheduling and resources. Maria sent memo March 8th, 2021. Waited for response. Waited. A week. 2 weeks. No response. She sent follow-up email. March 22. Did you receive my memo regarding flatware inspection? Please advise how to proceed. Deborah replied, Oh yes, got it. Been meaning to get back to you. Let's discuss at next department meeting. Department meeting scheduled March 30th. But Maria didn't stop using the forks. Didn't remove all forks from service until inspection done. That would mean using disposable plastic forks. Increased costs. Increased waste. Needed director approval for that. So kitchen kept using stainless forks, including defective ones. Staff just threw away cracked ones as they found them. Reactive, not proactive. Problem was, Maria didn't know how many were cracked. Only found them randomly. Visually. How many cracked forks were still in rotation? Undetected. Unknown. I was one. My crack was microscopic. Sarah never noticed me. Maria never noticed me. But I was there. Accumulating bacteria. Third person who knew. Deborah Price, age 51. Director of Nursing, Sunrise Senior Living. She'd been nursing director 6 years. Registered nurse, 30 years experience. Responsible for all clinical care facility. Nursing staff, medical oversight, infection control, regulatory compliance. She reported to executive director. Deborah received Maria's memo, March 8th, read it. Understood concern. Cracked forks. Potential safety issue. Potential infection control issue if bacteria harboring in cracks. Should address. But Deborah also dealing with bigger problems. March 2021. COVID pandemic still active. Vaccination rollout for residents and staff. Testing protocols. Isolation procedures. Staff shortages. Multiple nursing staff out sick or quarantined. Deborah working 12 14-hour days. Crisis management mode. Cracked forks seemed minor compared to COVID protocols. She filed memo, intended to address at department meeting March 30th, but thought it's not urgent. We've been using these forks 2 years. Few cracks appearing now. Probably just wear and tear, not emergency. March 30th, 2021, department meeting. Directors and managers, nursing, dietary, housekeeping, maintenance, activities, social services. Monthly meeting. Long agenda. COVID updates. Staffing issues. Upcoming state inspection. Budget review. Resident concerns. Deborah chaired meeting. Went through agenda items. Got to end. Any other business? Maria raised hand. Mentioned flatware issue. Explained findings. Requested approval for systematic inspection. Deborah said yes. That sounds reasonable. How long would take? Maria said 4 to 6 hours staff time. Probably need to schedule for weekend when kitchen less busy. Maybe pay overtime or ask volunteers. Deborah said, Okay, let me think about budget. We're tight right now. See if we can find hours. Get back to you. Meeting adjourned. Everyone left. Deborah made mental note, follow up with Maria. But mental notes get lost. Deborah returned to nursing station. Dealt with resident fall. Dealt with family complaint. Dealt with medication error. Forgot about forks. April 2021 passed. No follow-up. Maria waited. Didn't want to be pushy. Director said she'd get back. Maria trusted that. But also kept seeing cracked forks. Sarah finding them. Other dietary aides finding them. Maybe 10 total by end April. Each one thrown away. But how many more were there? Still unknown. Fourth person who knew. Robert Walsh, age 58. Executive Director. Sunrise Senior Living. He'd been Executive Director 3 years. Business background. Healthcare Management MBA. Ran facility like business. Revenue, costs. Occupancy rates, profit margins. His job keep facility financially viable. Keep residents satisfied. Keep families satisfied. Keep regulators satisfied. Balancing act. Tight budget. Medicaid reimbursement rates hadn't increased years. Costs rising. Staff wages up. Food costs up, utilities up, insurance up, but revenue flat, margins shrinking. Robert constantly looking for ways cut costs without cutting care. Difficult balance. Robert attended management meetings, heard department reports, approved budgets, made decisions. But he didn't attend operational meetings like March 30th department meeting. That was director level. He attended monthly executive meetings. Directors reported to him there. Next executive meeting, April 15, 2021. Deborah gave nursing report. COVID update, vaccination status, infection control protocols, staffing challenges. Robert listened, asked questions, approved requests. At end, Deborah mentioned, oh, also dietary reported some flatware issues. Forks with cracks. Need to do inspection. Probably 4 to 6 hours staff time. Some overtime. Robert said, how much overtime? Deborah said maybe $200. Robert winced. Budget's really tight this month. Can we defer? Deborah said, I suppose. Not urgent. Just maintenance. Robert said, let's revisit next month. See if budget loosens. Deborah said, okay. Meeting continued. Robert didn't think about it again. $200 overtime seemed like unnecessary expense. Forks with cracks. Just throw them away as you find them. Why pay staff overtime to inspect 500 forks? Most are probably fine, only handful cracked. Not worth expense, that was his calculation. Financial, not safety. He figured dietary staff would handle it operationally. Find bad forks, throw them away. Problem solved. No need systematic inspection, no need overtime expense. Fifth person who knew. Janet Morrison, age 47. Housekeeping supervisor. Sunrise Senior Living. She managed housekeeping and laundry staff. Cleaned resident rooms. Common areas. Kitchen. Laundry services. Her staff worked closely with dietary. Helped with dish room, assisted during meals. Janet's staff noticed cracked forks too. April 2021, one housekeeper named Linda, age 53, was helping in dish room. Noticed several forks with visible cracks as she loaded dishwasher. Mentioned it to Janet. Said those forks looked dangerous. Cracked tines, someone could get hurt. Janet said, yeah, I've heard dietary's aware. They're dealing with it. Linda said, but I keep seeing them. Seems like a lot. Janet said, if you see any really bad ones, pull them out. Show dietary staff. They'll toss them. Linda said, okay, but felt like problem bigger than individuals pulling occasional fork. Felt like systematic issue. But Linda was housekeeper, not dietary. Not her department, not her responsibility. She mentioned to Janet. Janet aware, that's all Linda could do. Janet mentioned to Deborah at next management meeting. April 22nd, said housekeeping staff noticing cracked forks. Seems ongoing. Are we addressing? Deborah said yes. Dietary supervisor reported it. We're planning inspection, just trying to schedule it. Budget tight. Working on it. Janet said okay, just wanted to make sure you knew. Deborah said, appreciate it. Thanks. Janet left it there. She'd reported, not her department. Deborah would handle. Sixth person who knew. Dr. Michael Chen, age 62. Medical director. Sunrise Senior Living. He was contracted physician. Came to facility twice weekly. Saw residents, managed medications. Handled medical issues. Oversight role. April 28th, 2021. Dr. Chen noticed something during rounds. 3 residents with gastrointestinal symptoms. Mrs. Anderson, age 81. Diarrhea. Started 2 days ago. Mr. Patel, age 76. Diarrhea and vomiting. Started 3 days ago. Mrs. Rodriguez, age 73. Similar symptoms. Started yesterday. 3 residents. Similar symptoms. Similar timeline. Could be coincidence. Stomach bugs go around nursing homes. Residents' close quarters. Weakened immune systems. Easy spread. But 3 in 1 week seemed like cluster. Dr. Chen mentioned to nursing staff. Keep eye on it. Monitor other residents. Let me know if more develop symptoms. Could be outbreak. Nurses said, okay, we'll watch. April 30th. 2 more residents developed symptoms. Mr. Thompson, age 78. Mrs. Lin, age 84. Both diarrhea. Dr. Chen called Deborah. Said we have 5 residents with GI symptoms. This is outbreak. Need to investigate. Implement infection control protocols. Test stool samples. Deborah said, okay, we'll coordinate. Called dietary. Called housekeeping. Increased cleaning. Isolated symptomatic residents. Collected stool samples. Sent to lab. Results would take 48 hours. May 2nd, 2021 lab results came back. 3 residents tested positive salmonella. Foodborne pathogen. Common in contaminated food. But Sunrise Kitchen followed food safety protocols. Proper cooking temperatures. Proper storage. Regular health inspections. No recent violations. Where did salmonella come from? Dr. Chen consulted with local health department. They sent inspector May 3rd. Inspector came. Interviewed staff. Examined kitchen. Collected food samples. Collected environmental samples. Swabbed surfaces. Swabbed equipment. Swabbed utensils, including forks. Sent everything to state lab. Comprehensive testing. 7th person who knew. Health Inspector Thomas Liu, age 49. Massachusetts Department of Public Health. He'd been inspector 12 years. Investigated foodborne illness outbreaks. His job: identify source, prevent spread, ensure compliance. Thomas arrived Sunrise May 3rd. Interviewed Deborah. How many residents affected? 5 so far. When did symptoms start? April 26th. All still ongoing. Anyone hospitalized? Not yet. But concerned especially for Mrs. Lin. Age 84. Frail. Dehydrated. Might need admission if doesn't improve. Thomas asked about recent foods. What have residents eaten? Any new menu items? Any catering events? Deborah said no, all standard menu. Regular meals. Nothing unusual. Thomas said, okay, I'll inspect kitchen. Thomas went to kitchen. Met Maria, introduced himself, explained why he was there. Salmonella outbreak. Need to find source. Maria was nervous. Outbreak. That sounds serious. Are we in trouble? Thomas said not trouble, just investigation. Help me understand your procedures. Maria showed him kitchen. Walk-in cooler. Freezer. Dry storage. Prep areas. Cooking equipment. Dishwasher. Everything looked clean. Organized. Proper temperatures. Proper storage. Thomas took notes. Asked about food sources. Vendors. Deliveries. Recent changes. Maria said all same vendors. Same products. Nothing changed. Thomas said, okay, I'll collect samples. Thomas collected food samples, leftover items from cooler. Raw eggs, raw chicken, ground beef, vegetables. He also collected environmental samples. Swabbed cutting boards, prep surfaces, sink, dishwasher interior, and utensils. He collected forks, knives, spoons from clean bin, fresh from dishwasher, bagged them, labeled them, sent everything to state lab. Comprehensive testing. Results would take week. Thomas told Deborah, I'll follow up when results come back. Meanwhile, continue infection control protocols, monitor residents, report any new cases. Deborah said will do. Thomas left, filed preliminary report, noted facility appeared clean, staff cooperative, awaiting lab results. He'd investigated dozens of nursing home outbreaks. Usually found source. Improperly cooked food. Cross-contamination from raw to cooked. Ill food handler. Temperature abuse. Something. Lab results would tell him. But here's what Thomas didn't do. When he collected utensils, he looked at them visually. They appeared clean. No visible food residue. No visible damage. He didn't examine them closely. Didn't use magnification. Didn't look for microscopic cracks. Just visual inspection. Bagged them. Sent to lab. Lab would do detailed analysis. But even lab might miss microscopic cracks unless specifically looking for them. May 10th, 2021, lab results came back. Food samples all negative. No salmonella. No other pathogens. Chicken, beef, eggs, vegetables all safe. Environmental samples mostly negative. Cutting boards clean. Prep surfaces clean. Sink clean. Dishwasher clean. But one sample positive. Utensils, specifically forks. Lab found salmonella on 2 forks out of 20 collected. Same strain as residents. Source identified. Contaminated forks. But why were forks contaminated? Food was clean. Dishwasher working. Lab examined forks under microscope. Found it. Microscopic cracks in tines. Bacteria harboring in cracks. Surviving dishwasher cycle. Cross-contaminating food during use. Thomas called Deborah. May 10th. We found source. Contaminated forks. Your flatware has microscopic cracks. Bacteria hiding in cracks. You need to replace all forks immediately. Stop using them. Use disposable until new ones arrive. Deborah was shocked. Forks. The cracked forks Maria reported in March. Oh no. Thomas asked, what do you mean? Deborah explained dietary had reported cracked forks March. Visible cracks. We were planning inspection, but hadn't scheduled yet. Budget constraints. Thomas said visible cracks. That's serious red flag. Why didn't you act immediately? Deborah said we were going to. Just trying to schedule. Didn't seem urgent. Thomas said visible cracks in food contact surfaces is urgent. That's basic food safety. Deborah felt sick. Thomas said, I'm issuing citation. Failure to maintain safe food contact surfaces. You'll need corrective action plan. Replace all flatware. Document destruction of old items. Implement inspection protocols. Deborah said, yes, we'll do it immediately. Thomas said I'll be back in 2 weeks, verify compliance. Deborah hung up. Called emergency management meeting. May 10th afternoon. All directors, all supervisors. Robert, executive director. Deborah, nursing director. Maria, dietary supervisor. Janet, housekeeping. Others. Deborah explained. Outbreak source identified. Contaminated forks. Microscopic cracks harboring bacteria. 5 residents sick. 2 hospitalized now. Mrs. Lynn deteriorated. Admitted hospital morning. Severe dehydration. Mr. Thompson admitted too. Elderly. Weak. High risk. Health department cited us. Need immediate corrective action. Replace all flatware. Robert asked how much. Deborah said probably $2,000. Robert winced, but said do it. Order today. Maria said I reported this March. Visible cracks. Requested inspection. You said budget tight. Defer. Robert looked at her. Said what? Maria said I wrote memo, March 8. You said defer at April meeting. Robert didn't remember. Deborah said I mentioned it. You said defer. Robert said I didn't realize it was safety issue. I thought maintenance. Maria said I said safety, cracked forks, potential injury, potential contamination. Robert had no answer. Just said order new flatware today. Use disposable until arrives. Meeting adjourned. Silent tension, everyone knew. This was preventable. Multiple people knew. Multiple opportunities to act. No one did. Now 2 residents hospitalized. Could have been avoided. May 11th, 2021, 2 more residents hospitalized. Mrs. Chen, age 87. Mr. Davis, age 79. Both severe symptoms: dehydration, weakness. High-risk age group. Total 4 hospitalized. 1 more resident developed symptoms, still at facility. Mild so far. 6 residents affected total. Dr. Chen monitoring closely. Worried about Mrs. Lin. Age 84. Frail baseline. Salmonella hit her hard. In ICU. IV fluids, antibiotics, blood pressure dropping. Kidneys struggling, prognosis uncertain. May 12th. Mrs. Lin died, 84 years old. Admitted May 10th. Died May 12th. 2 days. Cause of death sepsis. Secondary to salmonella infection. Her immune system couldn't fight it. Infection spread to bloodstream. Organs failed. She died. First death. Family devastated. She'd been at Sunrise 6 months. Doing well. Independent. Mobile. Participated in activities. Then got sick. Then died. 2 days. Family hired lawyer. Started asking questions. How did this happen? What caused outbreak? Found out. Contaminated forks. Known problem since March. Not addressed. Family furious. Why wasn't it fixed? Why did it take outbreak? Why did mother have to die? No good answers. May 14. Mr. Thompson died, 78 years old. Admitted May 11th. Died May 14th, 3 days. Same cause. Sepsis from salmonella. Second death. Another family devastated. Another lawyer. More questions, more anger. May 15, 2021, outbreak continued spreading. 2 more residents developed symptoms. Now 8 total, 3 hospitalized, 2 dead. Pattern accelerating. Despite removing forks May 10th. Despite using disposable. Despite increased cleaning. Outbreak momentum. Why? Because incubation period. Salmonella symptoms appear 6 to 72 hours after exposure. Residents exposed to contaminated forks before May 10th still getting sick after. Timeline delay. Dr. Chen explained this to staff, to families. Outbreak will peak, then decline. But more cases coming. Already exposed. Just showing symptoms now. May 16th. Another resident hospitalized. Mrs. Park, age 86. May 17th. Another. Mr. Wilson, age 81. May 18th. Mrs. Rodriguez deteriorated. Already hospitalized May 10th. Now, ICU. Septic. Kidneys failing. Prognosis poor. May 19th. She died. 3rd death. May 20. Outbreak peaked. 12 residents total had developed salmonella. 6 hospitalized. 3 dead. 3 recovered home. 3 still sick, but stable. No new cases May 20th. Dr. Chen cautiously optimistic. Think we've peaked. No new exposures after May 10th. Existing cases working through. Some will recover, some won't. Elderly high risk. 3 already gone. More might follow. Families grieving, angry, confused. How did this happen? Licensed facility. State inspected. How did something this preventable happen? May 25th. Mr. Wilson died, 81 years old. Hospitalized May 17th. Died May 25th. 4th death. May 28th. Mr. Davis died, 79 years old. Hospitalized May 11th. Died May 28th. 5th death. June 2nd. Mrs. Park died, 86 years old. Hospitalized May 16th. Died June 2nd. 6th death. June 5th. Outbreak officially over. 12 residents affected. 6 hospitalized. 6 died. 6 recovered. Ages ranged 73 to 87. All elderly. All vulnerable. All exposed to contaminated forks between April 26th and May 10th. 2-week window, using forks with microscopic cracks. Bacteria accumulating in cracks. Cross-contaminating food. Residents eating contaminated food. Developing salmonella. Half recovered, half died. 50% mortality. Devastating. Investigation expanded. State Health Department. Center for Medicare and Medicaid Services. Federal Oversight Nursing Homes. Both agencies investigated. Interviewed everyone. Reviewed records. Found timeline. March 8th, dietary supervisor reported cracked forks. Requested inspection. No action. March 30th, department meeting discussed. Budget concern. Deferred. April 15th, executive meeting mentioned. Deferred again. Budget. April 22, housekeeping raised concern. Acknowledged, but not acted. April 26, first resident symptomatic. April 30th, 5 residents sick. Dr. Chen called outbreak. May 30, health inspector investigated. May 10, source identified. Contaminated forks. 2 weeks start of symptoms to source identification. 2 weeks contaminated forks kept being used. Exposing residents, causing more cases. All because systematic inspection never done. Budget deferred. Not urgent. Low priority. Citations issued. Massachusetts Department of Public Health cited Sunrise multiple violations. Failure to maintain safe food contact surfaces. Failure to respond to identified hazard. Failure to implement timely corrective action. Fines totaled $25,000. CMS cited for unsafe conditions. Immediate jeopardy level. Most serious citation. Facility placed on probation. Intensive oversight. Corrective action plan required. Monthly monitoring. If not corrected, facility license could be revoked. Lawsuits filed. 6 families whose loved ones died. Wrongful death. Negligence. Discovery process revealed timeline. Revealed memos. Revealed meetings. Revealed budget discussions. Revealed multiple people knew. Multiple opportunities to act. No one did. Families settled. Total settlements approximately $2 million. Distributed among 6 families. NDAs signed. Sunrise Insurance covered most. But facility reputation destroyed. Families pulled residents. Occupancy dropped. Revenue dropped. Within year, Sunrise Senior Living Springfield closed. Couldn't recover financially or reputationally. Building sold. Became different facility under different ownership. 7 people knew. Sarah dietary aide saw cracked forks February. Reported to supervisor. Supervisor said throw them away, but kept seeing more. Thought should inspect all. Didn't push, not her place. Maria dietary supervisor received reports, documented, wrote memo, sent to nursing director, waited for response, waited for approval, didn't act independently. Deborah nursing director received memo, understood concern, but busy with COVID. Seemed not urgent, mentioned at executive meeting. Robert executive director heard mention. Saw $200 price tag. Budget tight. Deferred. Janet housekeeping supervisor heard from staff. Reported to Deborah. Acknowledged, not her department. Dr. Chen medical director saw outbreak. Called it, coordinated response, but saw it too late. After exposures, Thomas health inspector investigated. Found source, issued citation, but came after 6 deaths. 7 people, each saw piece, each had role, each could have stopped it. Sarah could have insisted on full inspection. Maria could have ordered disposable forks immediately without waiting approval. Deborah could have prioritized safety over COVID competing priorities. Robert could have approved $200 over time. Janet could have escalated more strongly. Dr. Chen could have been more aggressive early. Thomas could have examined utensils more closely initially. 7 points of failure. 7 opportunities to prevent. 7 people who chose not to act decisively. They sent me here. Item 4. Not just for 12 residents who got sick. Not just for 6 who died. For being part of system that watched, system that had protocols, had checklists, had procedures, but didn't enforce them. System that valued budget over safety. System that deferred action. System that assumed someone else responsible. System that let 12 elderly residents get poisoned because 7 people didn't act. Mrs. Lynn, 84. Independent. Active. Loved gardening. Had family who visited weekly. Got sick May 10th. Died May 12th. 2 days. Because fork she used had bacteria in microscopic crack. Because that fork should have been inspected March. Wasn't. Because $200 seemed too expensive. Mr. Thompson, 78. Former teacher. Loved reading. Had great-grandchildren. Got sick May 11th. Died May 14th. Mrs. Rodriguez, 73. Retired nurse, ironically. Worked healthcare her whole career. Got sick May 10th. Died May 19th. Mr. Wilson, 81. Veteran. Korean War. Proud of his service. Got sick May 17th. Died May 25th. Mr. Davis, 79. Former mechanic. Loved classic cars. Had been restoring 1967 Mustang before health declined. Got sick May 11th. Died May 28th. Mrs. Park, 86. Immigrant. Came to America in 1985. Worked hard. Raised family. Proud grandmother. Got sick May 16th. Died June 2nd. 6 people. 6 lives. 6 families. All ended because 7 people watched and didn't act. All ended because checklists on walls meant nothing. All ended because budget mattered more than safety. All ended because urgency got deferred. All ended because system designed to protect them failed. Not because system didn't exist. System existed. Protocols existed. People knew. People saw. People just chose not to act. That's my 4th confession. Season 4. Episode 3. The system that watched. This wasn't ignorance. Wasn't accident. Wasn't unforeseeable. 7 people knew. 7 people saw. 7 people could have prevented 12 infections. 6 deaths. 7 people chose documentation over action. Deferral over decisiveness. Budget over safety. Assumption someone else would handle it. And 6 elderly residents died. Not quickly, not peacefully. From salmonella, diarrhea, dehydration, sepsis, organ failure. Over days. In hospital ICUs. Away from families during COVID restrictions. Alone. Suffering. All because checklists hung on walls and no one used them. If this story made you think about nursing home your loved one in good, check it. Visit unannounced. Ask questions. Don't trust checklists on walls. Don't trust protocols that aren't enforced. Hit like button. Write comments, what have you seen at nursing homes that worried you? Subscribe, Spoony and Friends. Season 4, 2 more episodes. 2 more systems that watched. See you next confession.